So welcome to the last webinar of the year. At the end of this very complex, challenging and sometimes quite difficult year, we felt that it really made sense to focus this webinar on the COVID-19 pandemic, considering it has consumed most of us and most of our time for much of the year. So from February, GISF was providing members and others space through our regular roundtables to discuss many of the critical issues coming out of the pandemic. I think we discussed contingency planning, travel management, stress and wellbeing management, and many other issues. And we've also more recently been adding additional modules to our COVID-19 guidance series, including the most recent one on preparing for the new normal. And hopefully the author of that one is joining us today, Elizabeth. So really reflecting back on those things that we've done as an organisation and on how much we've been trying to support members, we really felt that at the end of the year, it was really a good time to reflect on how the pandemic has impacted operations and our organisational preparedness and ability to respond to crises around the world. Of course, in addition to the pandemic, the normal business of humanitarian work hasn't stopped. The conflicts haven't stopped. The floods, hurricanes, other issues that we've been responding to, displacement and so on, has carried on. So really thinking about how we've managed to carry on at all with our operations during the pandemic. So the webinar today is going to focus on some analytical insights of some of the most pressing crises of the year, followed by two speakers who will share some of the lessons learned and some of the opportunities that the COVID-19 pandemic has presented. So we're joined by three panelists today, and the schedule is that we will have three presentations. Following each presentation, there'll be a short question and answer opportunity just for clarification, points of clarification and so on. And then after the three presentations, we'll open to a full sort of Q&A, moderated Q&A, which is where we'd really like your questions to be coming, either, as I said, through the question and answer function or the raise a hand function. Just something to add, right at the very end of today, we're going to have a very short introduction from Lisa Oliveira, who's working with the OSAC in the US, and they are just about to start doing a piece of work on or some research on duty of care and vaccines. So she's going to introduce that in the very last few minutes that we have. So without further ado, I will introduce all three speakers, and then we'll move to the first one and get going from there. So today we have with us Francesca Giovenzano, who is information analyst for the Crisis Insight team at ACAPS. She's going to set the scene for us, focusing on some of the analysis from the various reports that ACAPS produce, including the Severity Index, the Global Risk Report, and the Humanitarian Access Report. And she's going to be highlighting some of the kind of key areas affected during 2020. So that's sort of really looking at the sort of geopolitical overview. We'll then be moving to Christian Pibitz, who some of you know already, who's the Global Health and Safety and Security Director at the Norwegian Refugee Council. He will talk about the experience from the sort of head office perspective of the head office security manager perspective, and how they've been sort of managing their response and being able to continue working during the pandemic. And then finally, we'll move to Armstrong Maynard, who works with Population Services International based in Nairobi. And he will focus on operational considerations from the regional and national level, looking at a couple of sort of case studies and looking at security management challenges and opportunities through the lens of COVID-19. So I'm going to hand over to Francesca and ask her just to introduce herself briefly, and then take it from there. Thank you.
Hi, thank you very much. Thanks for inviting ACAPS. I'm Francesca Giovinazzo, and I'm information analyst at ACAPS since 2017, and I'm working with the Crisis Insight team. So I'm going to share the screen for the presentation. I hope you can all see it. So I'm going to introduce a bit what's the work of Crisis Insight and how we monitor and analyze humanitarian crises over the world. Specifically, I'm going to present the Informed Severity Index, the Global Risk Report, and the Humanitarian Access Assessment, or Index, and how through this, the analysis and our data models, we were able to highlight some deteriorating trends and risks for 2020. Some of these are related to COVID-19, are strictly linked, or COVID-19 was a driver. In other cases, we see how other deterioration are actually not related at all to COVID-19. Some of those we identified. So I'm going to start a bit presenting what is Crisis Insight. Crisis Insight, first of all, is a team of analysts sitting in Geneva and in Amman at the moment. And it's also a portfolio of products that includes the mentioned products. The Informed Severity Index and the Humanitarian Access Index or assessment are also data models, which mean that they allow us to actually gather information on a number of crises. And we do both collect data, mainly secondary data, at times primary, but the Crisis Insight team does not collect data in the field. So we collect them through these data models, and we analyze crisis level data. What does this mean? That we have, in some cases, multiple crises in one country. That's the case of Sudan, I'm going to present later, where we have multiple crises for the same country. Sometimes we have one regional crisis for multiple countries, and that's the case of the Western Mediterranean routes, for instance, on migration. And then very often we also have one crisis in one country, and that's, for instance, the case of South Sudan complex crisis. So this data model help us also categorize crises, namely with the Informed Severity Index that is done in collaboration with the Inform Group, which includes not only ACAPS, but also OCHA, the EU Joint Research Center, and other technical partners. We are able to categorize the severity of the crisis in each country or region. The role of ACAPS in the Inform Group is namely to collect the data, and also ACAPS helped develop the data model. And then we have the humanitarian access that namely helps us categorize the access level in each country. They are also actually comparable global dataset, and through these datasets, we are also able to extrapolate trends. And trends are very often the basis of our forward-looking analysis. So I'm going to first talk about the Informed Severity Index. The index has a number of indicators that fall under two main dimensions. So we look normally at the impact of the crisis. So areas affected, number of people affected, categories of people affected, IDPs, refugees, the conditions of people affected, so how many people are in need, how severe are their conditions, and then we look at information and data related to the complexity of the crisis. So everything is more linked to context and also to the operational environment. So humanitarian access, for instance, would fall under this dimension. So we publish the Informed Severity Index every month. And from the October and November 2020 collection, we noticed a deterioration for the crisis refugees in Sudan. So this deterioration, so the score, the category of the crisis went from a 4 directly to a 5, which is the highest level, was not due to anything COVID related in this case, However, it's interesting to see how also, being a refugee crisis, it was influenced by something that happened in Ethiopia's Tigray region, so conflict in Ethiopia, Tigray region, that was the driver for an influx of more than 50,000 additional refugees into Sudan. And this made that the actually through our model we could notice a deteriorating trends for the type of data we collect. So this is just one example. For the humanitarian access assessment, we also collect data for a number of indicators, actually 9. We have 2 quantitative and the rest are qualitative, and fall under 3 main pillars. So we look at access of people in need to aid and to services, access of humanitarian actors to affected population, and physical and security constraints. So the indicators are scored from a 0 to a 3, but the overall score or categories of the pillars are from a 0 to a 5. So in our report, we actually focus normally on the all countries that have access level that score a 3 and above. So high access constraints to very high access constraints to extreme access constraints. That's the case of Yemen or Libya, for instance. Now, I wanted more to focus and bring up Ethiopia. We published the humanitarian access assessment, so report and scores every 6 months. And in the 6 months from the report, so this was published in December, we noticed a deterioration in the access level for Ethiopia. And this was driven by a number of factors. So the political crisis, the onset of conflict in Tigray region, but also COVID-19 measures. For instance, the impact on the supply chain. In July 2020, we also tried to look a bit more closely at the direct effects of COVID-19 on the access situation in the country we monitor. And we really noticed that the impact was most evident in the 3 months following the declaration of the pandemic. And it was mostly related, the countries that were, let's say, where COVID played a major was a major factor for the deterioration of access was due to lockdowns mainly, and everything related to movement restriction, particularly ban on international flights, that did not allow the free movements of goods and personnel. This was though for the July 2020 that we look more closely at. For what concerns risk, so for risk, ACAPS focuses on marked deterioration very often, so it's often related to our trends work, but also to new risk. Overall, we try to look at any possible future events that might have a negative impact on the situation, on the population, on the environment, on the assets. So I can go to into the methodology later, but so we also have a 6-month forecast, and we publish the report every 6 months. We flagged some high risk level that were marked deterioration like Sudan and Yemen, but in particular, I wanted to flag Lesotho because Lesotho was one of the risks we identified where the one of the main drivers, if not the main driver, was COVID-19. And we had a risk on the reintroduction of COVID-19 mitigation measures, resulting in decreased access to livelihoods and a deterioration in food security. And the interesting thing is that with Lesotho, this risk was flagged of the reintroduction of COVID-19 measure, not for increased rise in cases in Lesotho, but in South Africa. So we analyzed also the linkages between the South Africa labor market and economy and Lesotho. However, this risk, as you can probably see from the slide, was categorized as a medium risk level. And yeah, that's a bit of an overview of the work we do and how we were able to flag deterioration and risk, both related and not related to COVID. And yeah, that's all for me, and I'm happy to take questions later.
Thank you very much, Francesca. That was a very interesting kind of, I know we could talk about any one of these single reports in much greater depth. So that was a very good sort of quick overview of where we're at. Does anybody have any very specific questions relating to the presentation before we move on? I can't see there are any questions in the Q&A. And I can't see any hands raised at the moment. So in that case, then we'll move straight on. So having introduced Christian Pibbets, I'll hand over to Christian now to introduce himself in a bit more detail and talk about things from the head office perspective.
All right, thank you. Just sharing the screen now. So put it on two nice quotes, as it's always a nice way to start. But one thing that became particularly apparent during the COVID situation was that there was an attempt to try to capture the situation as perfectly as possible, and we quickly realized that that would just take too much time, and hence the second quote that you see here in the writings. A white Italian says, "The best is the enemy of the good," and basically we refrained relatively early on from trying to have everything perfect, but just trying to basically capture the situation with the answers that are needed at the time and improve them as we went along. Just very, very briefly for me, I'm not going too much into detail. I've been around the block a little bit on the corporate side, as well as on the NGO side and on the academia. NRC is working roughly in the same areas that you see here. We are specializing in refugees, as the name says. And what do we do predominantly? Camp management, education, information counseling, and legal assistance, which we call ICLA, livelihoods and food security, shelter and settlements, and water sanitation and hygiene promotion. So just so you understand a little bit the notion of NRC. And now giving you a little bit the background in which situation NRC was when we experienced the situation. So we did have experience with Ebola and SARS, particularly in Central West Africa region. NRC is an organization that is highly used to firefight and also emergency response due to the focus on refugees. It has a very highly adaptable culture, but as a lot of NGOs, we experience a relatively high turnover compared to private industry, which of course creates its challenges by itself with regards to competency retainment and so on. We have around 400 international staff and around 14,000 national staff, half of them being incentive workers. And of course, they're highly motivated and dedicated to beneficiaries, which means they're very externally oriented. NRC went through a large expansion over the last 5 years, and we also diversified the funding base a lot, which of course brings its complexity with regards to donor requirements and donor contracts. The more diverse your donor base, the more diverse often the requirements and the compliance issues you're facing. We went through a recent restructuring like 4 years ago, now 5 roughly, in which regions were introduced. Why is that relevant? Because we're still in the process of basically formulating the role of the regions in that context. And we also have faced at the same time when the pandemic started, many change projects from introducing a new human resource database or digitalization processes and so on and so forth, which means that we were on the one hand in a regular operational mode with a lot of change management projects and a recent restructuring. And as you can imagine, when you're then faced with a situation like that, that is a relatively challenging situation. If you briefly look at the timeline, this is roughly the timeline of WHO alerts. I know there are reports out there that basically some cases were detected in France, like in November and so on and so forth. I cannot really comment on that for obvious reasons. But what is particularly relevant for us was here around end January. The first time we flagged the challenge with COVID-19 was actually around the 20th of January, which was, given now looking back, relatively early and gave us roughly a 2 weeks head start. So what happened? As I said, 20th of January, the situation escalated. We started up with a head office task force, which then at a later stage was then handed over to line management. Why is that relevant? So you have to imagine the situation got flagged. We established a task force. We established crisis management structures throughout the organization. And then after you have the first initial assessment phase, we basically realized this is not something that you can just manage in a crisis management setup. That is better if you manage it actually within line management, as it completely, utterly challenged the way how we regularly did business. Which means we had to go back to the drawing board and basically restructure, resystemize the whole way how we were operating with our projects, making them COVID-19 relevant for several reasons. On the one hand, because our beneficiaries were impacted by COVID-19, but then of course, the question was also how are we gonna have access if governments are shutting down and so on and so forth. So that was really relevant. We started a lot on the communication side, which means on the one hand, the digitalization process that we went through also gave us a little bit of an edge, meaning we could within 1 day establish a SharePoint site, which allows us to actively communicate to our staff, which we could improve throughout the situation. And by now has seen around 9,600 accesses. So it was also highly used and highly frequented. And that was very valuable, in addition to other tools such as workplace group for managers, in which, through which we communicated, or regular internal communication that we basically produced as well. Another issue that came along was the translation of documents. So as you can imagine, in that situation, we had a lot of HR questions that came up. We had to establish a new contingency planning for COVID-19, and all of that had to be translated in our main languages, which are English, French, Arabic, and Spanish. And that by itself had a certain notion of slowing down the response due to the lack of translation. We had a lot of coordination to do. You see the entities down there. But at the same time, we see some of the reporting. We had, for example, a monthly report form, which we ceased. But in the exchange, we introduced a COVID-19 report to ensure that we keep an overview about what's happening globally to our staff with regards to COVID-19. To date, unfortunately, we suffered one dead colleague, which wasn't infected through the work of NRC, but nevertheless. What I was trying to say here is that we recognized we have a lot of reporting, and with COVID-19 in addition, they came additional reporting requirements. Hence, we revisited to what extent is it really relevant to continue the regular reporting. And we changed that until summer this year, and then in autumn this year, we reintroduced the regular reporting. The primary drivers were, on the one hand, for us, of course, protecting our staff and saving our staff where possible, and then, of course, protecting and saving beneficiaries, and then the assets, and then the last, of course, our reputation. What are the challenges we faced? What you see in the top right corner is the risk matrix that we basically came up with COVID-19, which we segmented out. On the one hand, what is the rough escalation of the trajectory of the infection? What is the availability of medical response available in the country? What are movement restrictions? To what extent does it affect our PESTEL, political, economical, social, technical, environmental, legal environment we're operating in? And last but not least, what is our actual operational impact with regards to staffing, and that all formed then our COVID-19 risk rating. What are the challenges we faced? Well, on the one hand, what is the best organizational setup to do to deal with it? Task force, CMT, and as I said, we ultimately landed, I would say, 1.5, 2 months down the escalation, actually with line management, with additional focus on COVID-19. One challenge that we are still discussing on a regular basis is duty of care versus stay and deliver. Where do you draw the line here? And that is regularly discussed. Of course, the do no harm principle, just because we have the notion we want to help people, poses the challenge of, well, are we potentially contributing to spreading the virus? Then the next challenge was PPE versus staff and health workers. Who needs that protection gear more? And of course, we landed on the issue that, you know, medical frontline workers have a higher need on that. But then again, if you basically do COVID-19 relevant work, that becomes an issue then as well. Donor flexibility became an issue with regards to how flexible are donors in redistributing funds or reprioritizing funds. Then the virus spread dynamic. That was not a linear escalation, as you all know by now. It comes in waves, and it is very much depending on the response of the government. Testing became an issue, and so on and so forth. The next question was push versus pull. To what degree do we actually push everything down? And basically the way how we landed on is what in the beginning we pushed a lot down, and then after like 2-3 months, we basically started to take it a bit easier and actually gave the organization time to digest, on the one hand, the regulations, but then on the other hand, also match them with whatever the various governments responded to. That became particularly relevant because not every country was hit at the same time. Africa still sees a very different trajectory than Europe or the US, for example. Different phases of bottlenecks and alignment needs, country office, head office, regional office. Then the big question went to cut corners, particularly when it comes down to liability. For example, a rethinking of logistical requirements. Movement, we introduced a full team by itself that dealt with airbridge solution from United Nations, staffed with 4 people, which I'm very happy also won the Innovation Award within NRC. These were 4 people across the organization, which never have worked together before, had to handle over 7,000 emails in that short time to get to establish a red line for our staff to go in and out of mission areas. Then, of course, training needs. For example, we have currently a waiver for 2021 when it comes down to our regular standardization. We're talking about heat requirements for international staff, heist requirements, our training packages that we usually have. And then again, how much time do you work on reporting versus how much time do you attribute to planning, meaning forward looking versus reactive. Communication, I mentioned already. I think I'm a little bit out of time, so I'm speeding up a little bit. Outlook forward, well, we are very much monitoring the situation, of course, and the uneven trajectory when it comes down to reopening of regions, shutting down of regions, and so on and so forth. We are very much aware of a potential second, third wave and potential mutations, notwithstanding that some are already talking about mutations out there. Then the secondary impacts and the tertiary impacts are still to come. You know the notion that there are a lot of people that suspect a worldwide economic crisis within the next 3 to 4 months. Again, balanced duty of care, staff to deliver, scenario planning, and of course what we are looking at, but we're still waiting on, that is to look at the impact of the availability of vaccinations. Now, one small thing that I just want to briefly share you when I talked about the COVID-19 webpage that we introduced within one day. So just to have an overview, that's our regular HSS page. And then we created a separate COVID-19 within a day, which was really very handy, where you can basically share the various links, statuses, FAQ questions, and so on and so forth. And we have a trajectory also on how our staff is affected. versus external sites. You've also see the ACAP site here, lockdown trackers and so on, and then our internal reporting. This is currently our country COVID risk rating that is updated once per week. So our staff has very up-to-date information on what's going on globally, and this is see around roughly 9,600 access sites so far. So that has been seen as very handy. So that was it from my side. So ready to take any questions if you have.
Thank you very much, Christian. I know that's again a lot of work that you've done in the last year, and a huge amount of organizational structure and so on that's you've tried to explain to us in 10 minutes. So I'm very grateful for that. I think we'll save most questions for the end. I just have one brief question, which was that you we'll save most questions for the general Q&A because they may also be answered by other panelists. But you mentioned just at the beginning of your presentation that you were able to flag COVID as becoming an issue quite early. Is that what kind of sort of information management systems do you have in place that you were able to sort of pick that up earlier than others, perhaps?
I could make a very nice claim now, but in all honesty, I would shut it down to pure luck because I was stumbling over a WHO report. It was actually that simple, in all fairness.
Fantastic. Okay, we'll I think we'll leave the rest of the questions till later because, as I say, I think they may be answered by the panelists as well. And at this point, we'll move on to I'll introduce Armstrong. And if you're there, Armstrong, if you'd like to introduce yourself and then move into your presentation. Thank you.
Yeah, thanks, Heather, for that. And yeah, my name is Armstrong Maina, and I work with the Population Services International. I'm based in Nairobi, and have been working in the continent for the last 12 years. And my presentation will be sharing the context of how we've been managing security at the country level. My presentation share. You'll be able to see the presentation.
Yes.
Yeah. Yeah, the context for the countries that I'll be comparing is two countries, and this has been I look at the Malawi and Ethiopia, and these are two countries that have experienced different threats at different levels during the year. So every business, as we are all aware, has been impacted by COVID at different levels. And I would say that at the initial stage, we kind of reacted in a panic way. So we have this new threat that is not our typical medevac requiring incident. We are used to armed conflict, post-election violence, and kidnapping. But now this became a new threat which required a different approach. And at the first time we had uncertainty, panic, and we had operational challenges because we are used to having like this fighting in South Sudan. We sent staff to either Nairobi or Entebbe. Now this is a situation where we could not send staff to these other countries. And that we quickly moved out of that when we realized that this is a global issue, that we don't have a time frame when it will be resolved. And we moved to the second stage, which was to adapt to an ongoing threat. And that's the time we started a new normal. We started having staff return back to their countries voluntarily. And as the situation escalated, we had staff being asked to, those who had conditions that required them to travel back to their home countries. And this is the level where we started looking at COVID like a threat that we are likely to stay with for a long time. And it became part of managing multiple threats, which led to our revision of SRAs. And I would say that this is the point where we no longer had a low-risk country. Every country became high risk depending on the medical support, the testing, and other issues. And since then, we have already moved to the third stage, which I would call transitioning. This is a new normal. So now we start getting vaccines, but these vaccines, we never know which time they will be able to reach out to all the other countries. And as of now, I would say at the field level, we are managing COVID like any other typical SRA, security risk assessment threat, and looking at different factors now in terms of the country where the staff is likely to travel. And I think also at the field level, the security department expectations increased significantly. And we were expected to respond to staff requests. How can we go to the office? Is it a HR issue? And as the previous presenter has just indicated, the headquarters started this task force to deal with COVID. And the global strategy was quickly domesticated in the other countries. So I would say that we quickly moved to adjust our security policies and worked more closely with other departments within the organization. So to compare Malawi and Ethiopia, I've looked at the pre-COVID and COVID on how we have been managing a crisis. So I'd say during pre-COVID, communication was working as expected. We had phone, we had satellite phones, internet. For staff who didn't have access to internet, they could also always meet at the office. So I would say we had redundancy in that. But came COVID and this now changed. We started having communication failures where some staff who rely on internet from the office had to buy modems. And sometimes the modems were not working. Sometimes when they are working, they don't have electricity at their houses. We experienced civil unrest and communication shutdown in Ethiopia. And our only way to reach out to staff was now cut. Then we have the limited movements. We had few staff who could attend the office because of social distancing. Then when we are managing traditional security threats, like when there's armed conflict or terrorism, it's always easy for the staff in country or anybody within the region to support them. But during this time, we've seen like even low-risk countries, even to go to travel there to support them has become quite a challenge because of where you're traveling from. And these have now transitioned during COVID time where we have to deal with multiple threats. And giving an example with Malawi, we had an election, then there were like protests. The protests became violent. We had an election which was affecting even how our staff would social distance and also manage the riots. So I would say like now Malawi, which was a low-risk country, transitioned to a high-risk country with COVID and violence. So another quick one, I would say like most of the time we rely on expatriates in country to support with managing of these risks. During COVID, we've had expatriates left the countries. Some were in countries where they have 10-hour time difference. And the national staff also, not all of them could go to the office. And we had limited physical meetings. During high risk incidents, we usually send either a security manager in country to support the CMT at the country level. This time we had to rely on remote support, and there was not even evacuation to a neighboring country. We had multiple skills in country when we had the expatriates, some regional and headquarters staff visiting who can support. This time around, we have limited skills and staff working from home, some with very poor internet, so you cannot even communicate with them. We have always factored in headquarters support during a crisis, and now this has been shifted to the local staff who are in country at that particular point in time. So the incident management role from the CMT, which is well trained, during COVID, we had to transition that, innovate, and ensure that multiple staff can play different roles, because if one staff is exposed, then we have to wait 2 weeks before the staff goes to the office. I think quickly for the lesson learned, I would like to say that virtual support has been expanded, and we have remote management support at all levels within the organization. And the staff, I would say now, are better prepared in managing multiple threats at all levels. And this has been experienced, for example, in Ethiopia, where we had communication cut down in Tigray, in the staff who are there, and I would put that on previous trainings. We've used the traditional methods to reach out, where staff write notes and send through to the UN, and somebody at the UN sends that to our staff in Addis. So I would say like the staff became very innovative in how to communicate and reach out to their national headquarters. I think training and of worst case scenarios in incident management has been, it became an important role where experts and national staff training together has been, has helped a lot, especially managing multiple threats. For example, in Ethiopia, where we had both civil unrest, we've had conflict and COVID at the same time without expatriates on ground. Timely communication, I think this one has helped a lot when staff started receiving communication on what to do, and it impacted all staff. So I would say we also got a very good buy-in from security, because any email shared was discussed within the entire organization department. Inability to communicate quickly could have led to panic and have negative consequences. In some staff who did not receive information, they were relying on either WHO, CDC, and others until the organization started sharing the centralized SharePoint COVID-related information. Communication shutdown, as I said, it worked for us very well in Malawi, where there was civil unrest and election, but in Ethiopia, it didn't work very well, and we had to be very innovative in incident management. Liaison and mutual agreements with other NGOs and UN, I would say we tested the saving lives together in a Tigray, and those connections that usually your staff at the field level have with the UN and other organizations can really help during joint evacuations, as we had in Mekelle. Last slide, opportunities for national staff to manage multiple threats. We've seen some of our national staff take leadership roles in managing this, and some of them became very instrumental in how they were sharing, even how they manage communication in difficult situations in Tigray, and we've used that to share with other country platforms. I would say security function has really grown. We've worked more closely with other departments than ever before. There is improved productivity and efficiency with minimal resources. I would say this, we've had situations where the postpaid office line has been used by several staff on different days to make sure that they can be reached out. I think keeping staff and beneficiaries working is in a safe environment has somehow also led us to underestimate other threats. I would say like road traffic accidents is not taken as serious as we used before COVID, because everybody else is always talking about COVID. In crisis planning, we need to explore different scenarios and how this could affect the organization in both short, medium, and long term. And this crisis has showed us that long term could be 2 to 5 years. It's not a matter of whether a crisis will hit, but I think this has really shown us that a low-risk country could end up becoming a high-risk country. And every organization should be prepared to deal with multiple threats. Lastly, remote working practices should be incorporated in all entire organizations' crisis management protocols. So that's all from me.
Thank you very much, Armstrong. That was a very comprehensive look at overview of what what you've been working on and what this crisis has meant for you and your organisation. Does anybody have any specific questions for Armstrong before we open up the sort of Q&A session in general? I know there are some questions now in the Q&A. Perhaps while you're all thinking of questions, I'll kind of start with one. Armstrong has just talked about some of the opportunities and lessons learned, and this is a question. Then I guess if we ask perhaps Christian first and Francesca, and then come back to Armstrong. So some things clearly have worked very well. Such as national staff taking or being given more sort of leadership roles and more responsibility, and ways of working being quite efficient and cost effective. So what are the things, I guess, coming out of this that you've learned in the last year that are actually positive, that your organization will be taking forward regardless of whether COVID kind of hangs around for much longer or not? Perhaps ask Christian first.
I think that's a good question, but I think it's a bit too early because I don't know if the organization might swing back on it. But one thing that certainly was kind of an enlightenment is how many jobs can be done remote. So I think a certain amount of additional remote work will continue to stay. Another element is a reduction of international travel. That is also something that I think will, to some degree, continue going forward. And thirdly, also in relation to jobs, it certainly was a bit of a catalyst with regards to our anyway existing nationalization process. So I'm sure there are more, but these are the top 3 ones that would come to my head. Yeah, sorry, maybe adding a 4th one, because Elizabeth, I saw, mentioned it. Yes, we started 3 years ago to be set up as a health, safety, and security section. And the reason for that is because that is a system that actually has proven to be very, very valuable coming out of the production industry. So I think it is an advantage to look at the whole HSS, sometimes EQ, environment quality, in a more holistic approach. And I think having already been on the path for that kind of system was certainly a little bit helpful.
Great, thank you. Francesca, do you feel that there are things that, in terms of ways of working, that ACAPS has seen as an opportunity from this pandemic?
I think ACAPS is different in a sense that we are not an operational organization. So even though we are in the field, so right now we have colleagues, also colleagues who have been alone in lockdown in Cox's Bazar or in Colombia, we do really, I mean, eventually the flow of our work or the projects we have change a bit, but we can really easily adapt to remote work. We do have big teams normally in Geneva or in Amman, where so not always we are on the ground. So for us, I think it's a bit different. It's definitely probably a lesson learned for everyone this year, but it's true that like a lot of our work, especially when we do secondary data analysis, can be done from our computer, rather in the office or at home. So we did also adapt, but probably differently from any other organization that has operation and way more people in the field.
Thank you. Armstrong, I mean, your final slide spoke to this quite a lot, but is there anything you'd like to add?
The only thing I would like to add is that the digital and virtual support should be incorporated at every level, because we've realized that if you don't have this in place, it could take a long time to even establish that and conduct any training. So I think it is high time that organizations incorporate the technology aspect at all levels within the organizations, from HR, security, program support. It should be incorporated. That this is an opportunity to make sure that all those are incorporated.
And is that something that your organization is working on?
Yes, this is something we are working on, and we're also developing quick to use tools for security focal points. And they have like a checklist on, in case this one happens, this is how we conduct an assessment. These are things to check. So we're also making it as simple as possible to be used by any of the staff in the office.
Great. And I'm sure some of you will have seen the COVID-19 GISF guidance series and some of the modules there. And one coming out in probably by the end of January will be on digital security, because we've recognized that in discussion with members that is an issue with so much more emphasis on the virtual kind of operating space, and so many more people working in different kind of environments, working from home and so on. We recently, or earlier this year, GISF published the new module on digital security in Security to Go, which has lots of general, very good recommendations, but in a sense we'll be updating that with this extra kind of looking at it through the COVID lens and what that means in January. So something to look out for. So another question in the chat, perhaps we'll go to Christian first with this one. You did mention that you sadly had a death of a staff member. How is your organization, how can you tell if somebody has contracted COVID through their work or through their sort of personal life, as it were? And is your organization, would you treat it any differently anyway?
Well, in that particular case, we did know, or we had the information that he unfortunately got infected through a family member. So that would have been, an illness outside of a work remit. If somebody would have been infected through the work, that of course would have been covered through our insurance and so on and so forth. For the details, I would need to refer actually to HR, I have to say, but I do know that they looked into all the details and so on and so forth. We did have certain challenges with regards to, we have a global insurance that covers certain aspects, and then we have complemented that for national staff with local contracts in the various countries, and that differs, of course, and because also the national health system differs. So I think going forward, this is one of our priorities in the year 2021, that we're basically making an as-is a status update of where are we globally with those national contracts and how do we potentially fill any gaps. But yeah, that's the situation.
Great, thank you. I guess the tricky thing is that, I mean, it may have been evident in this particular case, but in many cases it won't be clear whether somebody has or how they've
differs really a lot. Like for example, United Nations offered generally to medevac national staff out of the country. Needless to say, there are all sorts of other issues that come with it, from visa to whatnot, right? Then you have situations like in CAR, where you have one ICU unit available for the whole country. So it really differs a lot from country to country, and it's very often an individual judgment call.
Thank you. And Armstrong, how is PSI dealing with this issue?
Yeah, I would say that within PSI, each and every country has their own like medical insurance, and all the levels of like Medivac for internationals is different because they have international cover. And that cover would take them back to their home countries. But for the national staff, it's all dependent on the local medical insurance coverage.
Great, thank you. So moving on, I think to also something that both of you operational organizations mentioned on coordination. You both mentioned that you have wide links with many different bodies, and some were very helpful, in particular in terms of Medivac or the air bridge and things like that. But do you feel that there are particular relationships that have flourished because of this situation, or perhaps other relationships that have become more difficult because of it? You don't have to name names, but it's yeah. Perhaps Armstrong, should we go to you first, as you're spotlighted?
I think personally, I would say that I've never seen departments work so closely than this during COVID, because every decision made has impacted the organization at all levels. Just to give an example, if somebody needs to travel to a country because of a mission critical trip, then that would, it's affecting like HR and programs, and also international insurance coverage. And these people have been looked at all levels, and travel approvals have also changed, because all these departments have to be looped because of any impact or any incident during that travel. Then all those required to approve anything or make a decision have to know that we have a staff traveling to South Sudan or Ethiopia or another country. I think personally, I would say the interdepartmental working has greatly improved, and it also created an opportunity for everyone within the organization to learn more about other departments. So I think it has created that opportunity also for people to learn what other departments.
Great. Do you think that the work, I think you mentioned it in your presentation, has sort of raised the profile of your specific team's work, the security work? Do you think it has sort of raised the profile in the organization? Do you see it as an opportunity, again, going forward, that you might be able to sort of take advantage of that sort of greater profile that you might have now in the organization, or more visibility? So I'll ask Armstrong first, and then we'll go to Christian.
Yeah, I would say it has greatly improved the security buy-in. I've had staff asking questions like, can I go to work and like I'm not feeling well? So some of the questions that typically go to HR have been channeled through security. So I would say that this is a good opportunity for security to build in health, safety, and security awareness because I think the bandwidth of people listening to security is at the highest possible level. I think it's a good opportunity to introduce country trainings, online trainings. They are being well received at the country levels more than ever before.
Great. And Christian?
Yeah, I would very much agree with what Armstrong said. Even though we were, set up or on the way to be a health, safety, and security section, it was relatively new. And of course, we also heard so you guys are doctors now, kind of, which obviously we aren't. And of course, you need to rely on the real experts, like WHO and so on and so forth. But it did change, or at least I would hope it had changed a little bit the perception of the formerly more hardcore physical security oriented perception to a more health, safety, security, more rounded kind of perception. Every single one of our HSS staff has been a COVID-19 focal point, and with that responsible for the whole contingency planning in relation to COVID-19. So I think it also helped us to integrate ourselves more into the organization, and also show much more added value with program. And on the other hand, it certainly improved also an understanding about what HR does and what they're capable of and what they are good in versus what we can contribute from our end. Because HR does per se not respond to medical emergencies and does not write the medevac plans and so on and so forth. There's also an absolute lessons learned inside the organization. Yeah, would agree with everything Armstrong said on that.
That's great to hear. I mean, it's something that we're very keen on promoting in GISF, is the helping security teams particularly to work across the organization, not to be kind of siloed, as is often the case. And I guess this because of the nature of the pandemic, this perhaps has been an opportunity for to raise the visibility of security teams, but also for those teams to work with parts of the organization that they perhaps wouldn't have naturally worked so closely with, or would have had much stricter sort of barriers between them. So to hear that sort of opening up between different departments and different teams and so on is something positive coming out of this. Perhaps we'll move now to like a big question. We'll go to Francesca for this one, if she doesn't mind. So just sort of looking ahead at 2021, I'm not sure how far ACAPS it sort of does any sort of forecasting, but sort of looking at sort of which contexts look like they might be sort of deteriorating, which are the ones that are sort of going up in terms of the different the severity index and other issues, which, I mean, perhaps there's the expected ones, but also are there any unexpected ones? I mean, you mentioned Lesotho. I mean, are there others that are sort of rising up the ranks, if you like?
I think an interesting thing, so normally we forecast 6 months to 6 months. An interesting thing probably to highlight is that I think we will focus or are giving more attention to those crises that before were not scoring very high, but now due to the impact of the measures, we are seeing like an economic decline that eventually was there, but that it was aggravated. So now, for instance, we are on we didn't raise them as risk yet, but we have on monitoring some country. I think the latest, I don't remember if it was Zambia for food security, but also in relation to the economy. So we are also looking at those countries that normally, let's say for us, are not, we do monitor them regularly, but we always tend to report on our crises that are categorized as 5 or as 4. I think since COVID, we're giving a bit more attention to what are the structural problems and how a pandemic could aggravate them, or what are the vulnerabilities and how a pandemic could aggravate them. That's how we see Lesotho is the latest. Now we're working on the next one. But yeah, I can say, and also crises that, for instance, were already flagged in the past, but Nicaragua, for instance, but also seen from a different angle. So overstretched capacity, health system, economy again. So yeah, we're probably seeing also way more elements or giving attention. As I said, sometimes there were already vulnerabilities there, or and this time they are just more evident because compounded by the pandemic.
Yeah, absolutely. Thank you. Just, kind of bearing that in mind, a question to both Armstrong and Christian is, what happens if the pandemic sort of remains with us for the foreseeable future? I mean, I know it will remain with us, but there's obviously a lot of hope at the moment about the sort of various vaccine programs. But given that those are quite experimental at the moment and kind of early days and so on, what are your organizations thinking about how long are you forecasting ahead? How long are you planning ahead in terms of how long you might have to work in this sort of different way? Christian, perhaps first.
Well, we take it a little bit one step at a time. So for the moment, our planning horizon on the HSS side is until the end of 2021, but taking into consideration potential implications for 2022. What do I mean with that? For example, the heat waiver that we said, we're not going to be able to conduct our 8 heats like we do every year because of the lack of face-to-face trainings, etc., etc. We're going to be reduced to 1 to 2. Meaning the high risk are going to be prioritized on that, but that means that we potentially create a backlog for 2022. So it's these kinds of things that we are looking at with regards to, let's say, operational HSS management planning. When it comes down to vaccination, was one of the questions also. We decided this week not to give out any recommendations yet on vaccinations because we feel it's a bit too early. And in addition, it is a little bit of a liability issue as well. So for example, it is linked to our insurance, and the insurance that we have is very much linked to the recommendation of the Norwegian government. So whenever we do something with regards to recommendation, we usually do a mixture between the recommendation from the Norwegian government and the insurance versus the recommendations from the local governments in which we're operating in. So we need kind of this dual approach for that, and it's a little bit too early on the vaccination. When it comes down to scenario planning and so on and so forth, that goes longer. We are, for example, engaging now in spring into the next 3 years strategy cycle. So we do go a more in-depth analysis, if you want to say so, in spring this year.
Great, thank you. And Armstrong, how about your organization? What's your thinking on this?
Yeah, just to add what Christian has said, we are also looking at it from the same light that we are looking at COVID as a regular threat that we have been looking at, like terrorism, and we are analyzing case by case for countries. I would say like most of the countries' expatriates have started going back, and some of them are returning by January of next year. And we are looking at this as a long-term threat that we will deal with the same way we deal with road traffic accidents. So the critical movements have already been ongoing, and each country and each individual is analyzed on case-by-case basis, and we have those checklists, as Christian said, like how you can support that, informing the insurance. So we have different levels of that. The same way we looked at previous threats on which person can travel to Somalia, for example, and what are the protocols you require on each and every country. So I would say like we are moving to long-term where COVID will just be analyzed like any other threat when staff need to travel.
And are you sort of braced for the financial crisis that might be well, some countries are already experiencing, and we might expect to sort of deepen into 2021. I mean, in terms of, your ability to fundraise, your dealings with donors and so on.
Yeah, I would say that the fundraising department has also taken the advantage of the crisis to switch some of the work that we do. And I would say, like, I've been seeing lots of digitization of health products that are offered to the beneficiaries. So in terms of fundraising, there's the traditional one, and they're also looking at the opportunities that come with COVID, and lots of digitization and supporting ministries of health. So there is the fundraising, will be impacted, but I think there will be growth when we start looking at it as a long-term health issues that we will continue dealing with.
And what about NRC, Christian? Are you expecting any sort of deep impact from the sort of economic situation?
I think it's too early. It's too early to say. I do think that we're gonna hit that this year we're gonna see the economic impact on a lot of the small and medium-sized businesses in a lot of countries. On the other hand, I don't think it's yet revealed to what extent the governments are going to respond with regards to aid. I mean, we know that the UK reduced theirs. So I think it can be expected, but we do not know the dimension yet. It's a bit vague as an answer, but I can't be more precise than that. I'm sorry.
No, sure. And Francesca, I don't know how ACAPS is funded, but are you expecting any sort of financial impact on your organization and your ability to continue your work?
Well, personally, I'm not. Well, I mean, being an analyst, I'm not very familiar with how it works and how's the situation right now for ACAPS. What I can say from a more analytical perspective, though, is that it's true that we have cases where we have been doing scenario workshop or also risk analysis and considering amongst triggers of a deterioration in access, for instance, or in operation. It was raised especially when having workshop with several organizations, whether funding is something that's gonna change funding levels and how. So it's conversation that definitely were kind of included in some of our analysis because it's probably a concern. But then for what concerns ACAPS per se, right now, I'm not really sure how it's gonna affect that.
Thank you. At this point, I'm going to hand over to or introduce Lisa Oliveri. We've just had a question that came up about vaccines. So Lisa is the Global SFP for the Education Development Centre and also the current chair of the Overseas Security Advisory Council, working the Development Working Group, which has recently changed names. I'm not sure what the new name is. So they are starting a piece of work of research around duty of care and vaccinations, exactly some of the issues that Christian mentioned. And so we agreed that we would give Lisa sort of 5 minutes or so just to introduce that work, and then we'll come back to the panel for any sort of concluding remarks overall. Thank you, Lisa.
Thanks so much, Heather, for the introduction and taking a few minutes of this session today so I can just talk about some of the efforts that the International Development Sector Committee, IDSC, is working on. And having spoken with Lisa Riley, there is definitely some room to collaborate so that we're not duplicating efforts with regard to some of the questions and concerns coming up around the COVID-19 vaccine. So our IDSC steering committee has been talking for the last 2 weeks about, many of us are going to be in the same position, watching and monitoring different information and trying to get as many questions answered as possible related to what organizational policies, protocols, and procedures will be when it's time to have staff vaccinated or when staff will be able to be vaccinated. So what we are doing is we are pulling together a two-part approach. We're doing a survey that will be released in January, February, and March to 3 different OSAC communities. So it's the IDSC, we'll be sharing it with the academia group and the faith-based organizations. And then we will also be sharing those same questions with GISF so that GISF has the opportunity to share it with its membership. And hopefully we can compile and collaborate on any results that come out so that we could see how different organizations are responding to or thinking through what their policies and procedures would be. There are so many factors and scenarios that are coming up regularly. So things like what happens if people decline to get the vaccine, if there are data privacy issues to be considered, what happens if different vaccines with different efficacy levels are available in countries where you have staff who want to be evac'd or transported to different countries to receive different types of vaccines. There are so many legal, human resources, and security things to consider. So getting some of that information pulled and doing that regularly is part of our strategy to keep the finger on the pulse of what the community is doing. The second part to our approach in addressing the vaccine-related issues is to come up with a resource of commonly asked questions or considerations that specifically the security community thinks is important to address with leadership around those topics that I just mentioned. So we'd like to pull those together and then also consult with subject matter experts in both the legal community as well as the human resources community, and then make that resource available to anyone who's interested in seeing it. So whether that's GISF, other OSAC communities, et cetera. And we hope to have that resource finalized and ready to release by mid-January, because again, even though, as I heard Christian and others mention, it's a bit early, these are things and scenarios that we have to start thinking about and planning as soon as possible. So I hope that that information is helpful, and if there are any questions, I'm happy to address them, Heather, but thank you again for the time.
Thank you, that sounds incredibly interesting, and I think will be very useful. I think it's, as you say, it is early, but
Has everybody lost Heather?
Yeah, we did.
It's fine.
Well, thanks, Lisa. That's great. That sounds interesting.
Thank you.
Does anyone, just while Heather gets back on, oh, there she is.
and those kinds of things. So
Heather, we lost you the last 2 minutes. So sorry.
You lost the last 2 minutes of Lisa?
No, of you.
Oh, of me. Oh, okay. I was just summing up. So we have one final question in the Q&A, which I think we probably just have time for if everybody just touches on it briefly. And it is, how do mental health plans for staff feature in your 2021 planning? You know, what are your key interventions? I think this is an area that's been talked about a lot in the past year, particularly because of the changes in ways of working, in all the different pressures and complexities of COVID, how it affects people individually in their personal life, through their work and so on. So it is something that we all need to focus on. So perhaps we'll go to Armstrong first.
Yeah, one of the things I've seen is like from the global security level, we've already started working with an organization that we regularly use on how to deal with mental health. And this is something that we are also asking the countries to make sure that is incorporated as part of their health insurance on how, because like stress will become one of the issues to deal internally with the staff. And once it's shared from the global level, then it's easier for like the HR and country leadership to pick it up and request for this specific kind of psychosocial support from their countries based on their country support levels. but it is something that has already been picked up already.
Great, thank you. And Christian?
Yeah, so if I visualize, it's easier. So if you see, basically, we have our own psychosocial support information site for managers as well as for staff that is linked to the stress management apps that are available, Healthy at Home. We have a contract with Haddington Institute, which are on the forefront on that. We have a psychosocial support helpline on that. We were about to introduce a peer system, a buddy system, 2020 that fell a bit short due to COVID, which we're going to focus on in the year 2021 together with HR.
That sounds like a very comprehensive approach and very, very well thought through. So, well done on that. Francesca, is there anything you'd like to add on this?
Yeah, I think very similar, although we, since we're all working remotely, almost all of us at the moment, we are also relying on a staff counselor. We have regular meetings. So I think kind of since the beginning of the pandemic, we knew we had this support already and we could use it, but probably, more awareness was done, and we decided also collectively in the organization to kind of share more, make use of the staff counselor, and also, since for us probably it's a bit different for the way we work, but we decided that being a lot offline, we organize online events and just to meet the people, especially those who are working remote and alone without a team, and they're often alone. So yeah, I think it's probably services that were already there, were already provided, but were not used so much until right now. Yeah.
Brilliant, thank you. I think that's a good positive note to sort of finish on. Really, is that that we do need to focus on these mental health issues, and that it seems like most organisations are thinking about it in some way. I'd like to thank all the speakers today, particularly obviously Francesca, Christian and Armstrong, and also to Lisa for her intervention on the work they're doing on vaccines. Thank you to everybody who's participated and been active in asking questions and so on. Hopefully we've managed to cover most of the questions. If there's not, you can always get in contact afterwards. We will be launching a quick poll now. So as just as before you leave, if you could just participate, that would be very helpful for us. I guess the other thing to say is that just to mention again that we have in GISF this COVID-19 series. We've had a recent module came out in November on preparing for the new normal, so covering some of these issues that we've talked about today. And we have 4 new modules planned for sort of January, February. So hopefully they will be useful, will continue to be useful. But please do keep engaged on this issue and keep in touch with us if there are things you'd want to discuss or issues that you'd like to raise or be considered for other forms of discussion. And I guess all that's left for me to say is have a very, very happy holiday, however you celebrate it, and we'll see you in 2021 hopefully.